minus 28. The mean filtration pressure is +1 just. This net filtration pressure causes a continual loss of the fluid from the capillaries, okay? It's not equal forces to direction. The mean filtration pressure at the pulmonary capillaries is +1 millimeter mercury. This value is derived as the follows, okay? Total outward pressure 29 millimeter mercury. Forces tending to cause movement of the fluid out of the capillaries include the capillary pressure is the 7 millimeter mercury. Interstitial colloid osmotic pressure is 40 millimeter mercury, and interstitial blood pressure is minus 8 millimeter mercury. The total inward force 28 millimeter mercury. The plasma colloid pressure 28 millimeter mercury tends to cause the absorption of the fluid into the capillaries. The net mean filtration pressure is +1 millimeter mercury. Because the total outward force 29 millimeter mercury is slightly greater than the total inward force is 28 millimeter mercury. The net mean filtration pressure is slightly positive, okay? 29 minus 25 is equal to +1 millimeter mercury. You can see in this here pressure causing fluid movement. In the capillary, hydrostatic pressure, osmotic pressure, and the net pressure in this here. And you can see in this here the lymphatic pump and the hydrostatic and osmotic forces at the capillary in the left, okay, and alveolar membrane in the right of the lungs. Also shown is the type end of the lymphatic vessels center, okay. This is a negative that pumps fluid from the pulmonary interstitial spaces, okay. And you can see in this here the forces is different, and but the net pressure is +1, and this high pressure is will be equal with the lymphatic pumps, and in the lymphatic pumps as a negative pressure and cause the exit from the fluid movement, and pressures in the lymphatic causes fluid movement and is not enter to the alveoli. In this figure you can see rate of the fluid losses into the lung tissue when the left arterial pressure and the pulmonary capillary pressure is increased, okay. We can see in the left arterial pressure increased to 25 millimeter mercury is not changed the rate of the edema formation. After the increase, the left arterial pressure from the 25 more, and the rate of the edema formation will be increased, okay. This is safety factors in this here. Pulmonary edema developed in the same way peripheral edema does, okay. Pulmonary edema develops in the same way peripheral edema does. The most common causes of the pulmonary edema are all as follows. 1. Left-sided heart failure or mitral valvular disease causes a great increase in the pulmonary capillaries pressure with subsequent floating of the interstitial spaces and alveoli. 2. Damage of the pulmonary capillary membrane causes by infections or breathing of a noxious substance produces rapid leakage of the plasma protein and fluid out of the capillaries. When the pulmonary interstitial fluid volume increase by the more than 50%, fluid discharge into the alveoli. Okay, therefore, except in the mildest causes of the pulmonary edema, the edema fluid enters the alveoli. The acute safety factors tend to prevent edema in the lungs. All the following factors must be overcome before edema can occur. 1. Normal negativity of the interstitial fluid pressure. Okay, caused by there are this normal negativity, and lymphatic pumping of the fluid out of the interstitial space we mentioned in the before and in the figures. Okay, you can see, and decrease the colloid osmotic pressure of the interstitial fluid causes by washout resulting from the increased loss of the fluid from the pulmonary capillaries. You can see in this figure the situation of the venous system and situation of the lymphatics and pulmonary arteries in this here and pulmonary veins in this here, and dynamic of the fluid exchange in the intrapleural space. The lymphatic system provides, therefore, a chronic safety factor against pulmonary edema. Lymphatic system is very important. And mentioned in this figure as well, you can see lymphatic system, and it's very big system, this in the lungs. Dynamic of the fluid exchange in the intrapleural space. The lymph vessels can expand greatly and proliferate over a period of the several weeks to months, increasing their ability to carry fluid away from the interstitial spaces by perhaps as much as tenfolds. In patients with the chronic mitral stenosis, a pulmonary capillary pressure of 40 to 45 millimeter mercury has been measured without the development of significant pulmonary edema. Lethal pulmonary edema can occur within the hours. When the pulmonary capillary pressure rises even slightly above the safety factor levels, okay, the lethal pulmonary edema can occur within the minutes to hours, with the acute left-sided heart failure, in which the pulmonary capillaries pressure occasionally rises to 50 millimeter mercury. That often ensues within the less than 30 minutes from the onset of the acute pulmonary edema. You can see, you should be remember the safety factors is very important factor, as this is the differences between the colloid osmotic pressure in the vessels and the other pressure. With the the capillary pressure 28 minus 5 7 safety factor levels is the differences between the colloid osmotic pressure in the vessels caused by the protein, and the difference this with the capillary pressure is 7, is 28 minus 7 is 21. 21 means is the safety factors. The importance of the pleural cavity. The normal collapses in tendency of the lungs is minus 5 millimeter mercury. Thus, the pleural fluid pressure must always be at least as negative as the pressure in the pleural cavity is the minus millimeter mercury to keep the lungs expanded. And the actual measurement has shown it to be 7 minus 7 millimeter mercury. Thus, the negativity of the pleural fluid keeps the normal lungs pulled against the parietal pleural of the chest cavity. You can see in this figure, pleural cavity in this here, and this the pleural have a parietal pleural in this here as contact to the chest wall, and visceral pleural is attached to the lungs. The pleural cavity is the potential space between the two pleural, visceral and parietal of the lungs. The pleural is a serous membrane which folds back onto itself to form a layered membrane structure like a balloon. It normally contains thin layers of the mucoid fluid. The outer pleura, parietal pleura, is attached to the chest wall. The inner pleura, visceral pleura, covers the lungs, and the adjoining structure as a blood vessel, veins, and bronchi. The amount of the fluid normally present is only a few milliliters. Thus, therefore, it is called a potential space, as it is too narrow to be an obvious physical space. Okay, and for finally, you can see in this here pleural effusion concept definition. Pleural effusion is accumulation of the large amounts of the free fluid in the pleural space. It is the same as edema fluid in the tissues, and can be called edema of the fluids. Okay, you can see in this sphere this normal lung and normal pleural, and is not normal is the lung is collapsed, and the pleural effusion is most, and the pleural is not normal, is abnormal. Okay, the edema of the fluid causes one, blockage of the lymphatic drainage from the pleural cavity. This one, lymphatic blockage of the lymphatic. Okay, this lymphatic vessel is very important for the preventing of the pleural effusion. 2. Cardiac failure. 3. Greatly reduced plasma colloid osmotic pressure is the safety factor. Is very important, this one. And infection or inflammation of the pleural surface causing leakage into the pleural cavity. And this chapter is finished, and the next chapter is about the principles of the exchange of the gas. Thank you. Goodbye.